New coronavirus cases continue to slow. According to Johns Hopkins University, the U.S. total for cases since the beginning of the pandemic stands at more than 25.1 million. The U.S. death toll has climbed now to nearly 420,000. Now, the end of the pandemic has become a race between vaccines and these variants. The new, faster spreading version of this virus, first found in the UK, has now been discovered in at least 20 states. Still, of the 41 million doses reportedly distributed across the country, only about half have actually reached arms. Hospitals across the country have described a desperate situation.
We don't know when we're going to be able to schedule an appointment for our parents because they just don't know when those doses are going to come and how many they're going to get.
We had a patient that stated they called 198 times to our call center, and the one next to him said, I called 173 times. So they are desperate. They're reaching out.
Yeah, I bet. People are ready. Health departments have said that so far the supply is unpredictable. Some areas are just now getting their first batch. A recent UK study looked at which groups are being hit the hardest by this coronavirus, and researchers found those with Black and Asian backgrounds were much more likely to die. The report, published in the British Medical Journal, is one of the largest studies yet on how the virus affects minority populations. Black patients were 1.3 times more likely to die from the virus compared to white patients. Asian patients were 1.5 times as likely. The American Academy of Pediatrics and the Children's Hospital Association now reports 200,000 children tested positive for COVID-19 in the second week of January. That's the largest weekly increase we've seen yet. So far, 2.5 million kids in America have caught the virus.